Our health lead now there is gathering momentum on Capitol Hill to provide help for the millions of Americans who suffer from diabetes. According to the American Diabetes Association, that is more than 40 million Americans, and at least 8 million of them rely on insulin just to survive. Democratic Senator Shaheen of the great state of New Hampshire is spearheading a bipartisan bill that would cap insulin prices at $35 a month, and she joins us from Capitol Hill. Senator, tell us a little bit more about what your bill would do, and does it have a chance of becoming law? I assume many in the powerful pharmaceutical industry oppose it.
Well, I think it does have a real shot at becoming law. 2 years ago, we capped the cost of insulin at $35 a month for everybody on Medicare. We think it's important to do that for everybody who has type 1 or type 2 who needs insulin. Right now we have 18 senators on the bill, equally divided, 9 Democrats, 9 Republicans, and we're increasing that number every day. So now we're up to about a fifth of the Senate, more than we've ever had on this kind of a bill. And we think it's important to try and provide some relief to families who are struggling with the cost of health care. And for people who have type 1 diabetes, they don't have an option of whether they're going to buy their insulin or not. And when it's a choice between the cost of insulin or putting food on the table, we need to provide some help. And this is one way that we can do it. We would require all insurers to cap the price of insulin at $35. We would set up a pilot program for people who are not insured so that they could also benefit from lower cost insulin. And we would create an expedited pathway to get a biosimilar so that we could get a generic insulin to make it cheaper for people.
So earlier this week, on this matter of pharmaceutical cost, earlier this week the president, along with others such as Mark Cuban, touted Trump RX. That's his own effort to reduce drug prices. It's adding some 600 generic drugs eligible for discounts through Trump RX. What do you think of that program? Do you think President Trump and Mark Cuban and others deserve some credit for that?
Well, I think anything we can do to lower the cost of pharmaceuticals is a benefit to the American people. We have to see how it gets implemented. But I would hope that the president and Mark Cuban and the administration would support this legislation, because this is a way to provide some relief to people who are really struggling with healthcare costs, which have gone up with the expiration of the premium tax credits. They're struggling with the cost of gasoline because of the endless war in Iran at this point. They're struggling with the cost of groceries. Anything that's transported, Americans are paying more for. And you add on top of that tariffs, which are costing families about $1,700 a year, and people are struggling. And anything we can do to help them, we need to do, and that's what this bill would do.